He needs no introduction. Dr. Kremchek, you spent 30 years working inside professional baseball, both as a surgeon and as a medical director. Not a lot of people have that vantage point. Watching athletes, injuries, expectations all evolve over time. Like I said, this is your 30th year. What excites you in your 30th year?
You know, it's not the injuries, it's the dealing with the players, the sport, the organization. I mean, to take care of a baseball team at the level of the Cincinnati Reds for 30 years, again, it's really not taking care of their injuries. It's involving yourself and being part of the team. It's being part of the organization. It's being part of a winning, you know, uh, an organization wants to continue to climb to the top. And the epitome of anybody who takes care of any team is number one, make sure their players are healthy. Make sure when they're hurt, you do everything you can within your power, or be able to get them in the right hands to get back on the field and play. I don't care what level it is, but also to immerse yourself in the organization, to be there when they're healthy, be there when they're good, be there when they're struggling. But when everything comes together and a team wins and an organization uh, wants to strive to go to the top, the playoffs, the World Series in this particular case, it's an awful lot of fun. So it's enjoying the game, understanding the mechanics of the game, the people who play the game, the people who watch the game. And it's evolved tremendously over the last 30 years, but there's no greater satisfaction to be part and be thought of as to be part of the team. And to me, that's what keeps me going. I want to go to spring training and really look forward, as we are this year, look forward to every season with enthusiasm, optimism, and really hanging on every pitch, every inning as you watch it during the season.
Yeah. When you think back to your early years with the Reds, what did professional sports medicine look like then compared to now?
Well, sports medicine in general is continuing to evolve. Sports medicine really started in the late 70s in its infancy and really grew into the 80s. I think a lot of it had to do with understanding mechanics. A lot of the stuff, for example, what you do in understanding how the body works, not how it works in general for sports, how it works for certain sports, whether it be overhead athlete, whether it be a baseball player, tennis player, volleyball player, lower extremity, soccer player, these young women athletes. It's really evolved into how important the sports medicine team is. And what I mean by that, it used to be the doctor that was taking care of a team. Now it's the doctor is a part of the team. The doctor has to include, and if he's smart enough, to be able to work with the trainers, the therapists, the chiropractors, everybody around that's going to help an athlete reach his peak form. And we have learned that there are so many layers to that. It's incredible where we started, for example, with the Reds 30 years ago from a nutritional standpoint, a strength and conditioning standpoint, a preventative standpoint, things we're doing with Pilates, all the stuff we're doing down in the training room, that quite honestly, there are so many more sophisticated people who understand this more than I do, but somebody's got to be the ringleader, somebody's got to basically take the reins and pull everybody together on each individual athlete. Everybody's got different age, different deficits, different abilities, different strengths, and different weaknesses. Figure them out, keep them on the field, and that's what keeps winners continuing to win and strive up to the highest level.
How has you talked a little bit about it, the collaborations between surgeons, PTs, chiropractors, strength coaches, front office. I mean, that's definitely evolved over the past 30 years, right? So how has that grown into something where, it's not necessarily so siloed out into these different subgroups. Everyone's working together for the greater good of the athlete.
That I think that's probably one of the biggest strengths, not just in baseball and not with the Reds. We're talking about all major sports and quite honestly into the colleges and high schools too. And it has to do with number one, respect. I think, when I came up and started, it was always the doctor. When I started with the Reds, they looked at me to do everything. Every aspect of medicine, preventative medicine, post medicine, injury prevention, everything that nutrition, things that I really didn't know a lot about as an orthopedic surgeon. And still, quite honestly, I'm just scratching the surface. But it's an understanding that, number one, it takes a team. And I'll tell you, whether it's the athletic trainers, the physical therapist, the internist, the people who do Pilates, the dietitian, nutritionist, strength and conditioning, chiropractor, it is a team, no different than the Cincinnati Reds, for example, or a baseball team that are made up of outfielders, infielders, pitchers, catchers. We're made up of orthopedic, musculoskeletal, biologics, movement specialists, all these people that have to come together, work together, communicate together to be able to give the athlete their best. And that has evolved tremendously, and it's continuing to evolve. In baseball, baseball might be lagging, quite honestly, behind the other sports. Really, the real winner and the guys that have a vision on the future of all this are the professional soccer, the European soccer, and we're learning an awful lot from them.
So, I mean, we know that you're working with such a high level profile of athletes. There's a lot of money involved with athlete performance now. Players have well-known agents, large sponsorships. They have contract incentives. How does that play a role in how you're managing injuries throughout the season as opposed to how you would have managed them 30 years ago?
You're 100% right. I mean, 30 years ago, 25 years ago, 20 years ago, when an athlete got hurt, the options were moderately limited. There were a couple guys that we worked with around the country. I actually trained down in Birmingham with Dr. Jim Andrews, who's in many ways a pioneer, but certainly the leader in sports medicine, and certainly the leader in baseball sports medicine. I think now more politics have become involved. Agents, free agency, basically arbitration. How everybody fits, it's contractually. We've learned that it's more of a business. So you've got to dance. But at the end of the day, it's still a people business. And what I have learned is that you've got to evolve. The players have to know you, they have to respect you, and they have to understand that you're doing everything in your power to help them the best you can. Now, whether they have an agent that wants to get other opinions, which happens really all the time, and vice versa, both ways. I see those patients from other teams, they see our patients from our team. That's fine, as long as you can put your arms around that, you don't get your feelings hurt, and you recognize that at the end of the day, the reason we're there is to take care of these players and really do the right thing for them. But, as you're right, with front office, it is a business. There's financial things that are involved with this, and that continues to evolve. It does sometimes get in the way of expedient care, the proper care, and the proper care of a particular athlete. And so you've got to be able to educate those people that are surrounding and might not really understand the injury. Make them understand, and make them understand the process of how and why you're doing this for an athlete to be able to have them further or enhance their career. So that becomes a time-consuming thing, and sometimes can be very difficult to navigate. I'm finding that easier as I go on here, but the hard part is trying to figure out who is not thinking in the athlete's best interest and trying to make them understand it. No. At the end of the day, it's the athlete that counts, because if an athlete performs, the team does better. The team does better, everybody wins.
There's something to be said about like building trust with the athlete you're taking care of. You were an athlete, right? You played college baseball. What do you think sets you apart from other physicians in gaining that trust because of all the high-level athletes that you've worked with?
Well, I think, number one, these players today, and it's not just in baseball, but high-level college and other sports, they can sniff out a fraud. Somebody who's there for the wrong reasons, somebody there for the promotion, somebody there for the financial gain, publicity, whatever it might be, the players know. And so, again, it's a people business. When I started out with the Reds, I love baseball. I played baseball, as you said, grew up playing baseball. I've always been a Cincinnati Reds fan. And I'm just using this as an example, but this goes to any sport at any level. The players have to know, number one, that you understand a sport, you understand why they're playing this sport, you need to understand the position that they play, and you also have to understand where they stand. For example, are they a rookie that needs to continue to play and grow to get a long-term contract? Are they a high school football player that needs to play to get a college scholarship? Are some of these players playing in college so they can either get drafted and go to the professional? You've got professional areas, and I see those every day. Is how make sure that they understand, that you understand what's going on here. It's not just an arm injury. We're talking about a person with a career and a vision and a goal. Everybody's different. And that's why these players have to see you day in and day out whether they're hurt or not, whether they're doing well or not, whether they're in a slump or not. And they have to know that you're going to be there, the good, the bad, whether they win or whether they lose. You're not just the guy that shows up during playoff time. That you've been there in June, you've been down there for 7-game losing streaks, you've been there through, people struggling, and you're also there for the high times. You've got to be a consistent. And I think they recognize people that are in it for the love of the game and for the reason to help them stay on the field healthy and be able to succeed in their careers.
Yeah, I think over the past 11 years and working alongside you down at the stadium, I mean, you can see where honesty comes into play, communication comes into play, and that just continues to build trust with those players that you're taking care of.
Honesty can be hard. Sometimes you've got to tell players things they don't want to hear. Sometimes they don't believe that. That's where the politics come in, agents come in, second opinions come in. But at the end of the day, if you know what you're doing, you're true to your craft, and you're true to the player, and you're going to be honest, and they know that you're not going to pull any punches, you're not going to try and play any funny business, you're not working for the organization to try to pull a fast one on them. No, you work for them. I've told players many, many times, I sit down in the office and I say, at the end of the day, I work with the Cincinnati Reds as a professional team as an example, but I'm here for you. I'm here to do what's right for you, for your family, for your career, for everything that you want to do. And one of the reasons I love working with the Reds organization is they know that about me, and they have never once, ever once tried to sway what I think we need to do, and why. They've never pushed me one way or another, and I respect them because that doesn't happen with most teams.
Yeah, I think you've built that reputation for yourself too. Let's get into a little bit of your specialty, Tommy John, right? So, kind of a then versus now. How has the surgery changed when you first started doing it to the surgery now?
Well, it's funny because I trained down in Birmingham when Jim Andrews was doing a lot of Tommy John, and that was in the early '90s. And Tommy John was really in its infancy. Tommy John surgery was first done in 1974 by Frank Jobe, one of, again, the pioneers and who's in the Baseball Hall of Fame. He actually did the procedure, the first one, on Tommy John. But there were only like 10 procedures done over the next 10 years that were Tommy John procedures into the 80s. And as we got into the late 80s and 90s, it started spiking. And we've learned a lot. We've learned a lot about, number one, who needs to have it done, which is key, how to image the right way. In other words, not everybody that's got a little bit of an injury to their ligament needs to have it fixed. But more importantly, I think we've learned different ways to do it, different ways to stabilize the ligament, different ways to rehab the ligament. And as I said before, we've evolved to understanding that it's not just an elbow. You're rehabbing the core body, the shoulder, the reason potentially that they injured their ligament. And take all that together with our rehab, our trainers, chiropractors, everybody who's involved. We've been able to take that teamwork to make these athletes better. It drives me nuts when I hear doctors say, yeah, I did Tommy John and I made him a better pitcher. No, you didn't. No, you fix his elbow and you let everybody around, the therapist, the player themselves, do things that they've never done before. Better movement, better strength, better kinematics, whether it be from their lower extremities to their hips to their core to their shoulder, and you've made him a bigger, stronger athlete. The athlete's done it, and the people that have worked with him in rehab have done that and allowed him to become a better pitcher. And I see that every day, and that's very gratifying.
So, playing off of that, obviously surgery plays a clear role in getting these athletes back on the field. But what we're seeing from a clinical perspective is that the system doesn't change, right? There's still kids that are needing a second or third, Tommy John. It becomes part of a cycle as well. In your experience, what does surgery, what does it work long term for those people who are able to return after the first Tommy John and not have a second one? Like, is there a different environment that the athlete is coming up in or working through after the first Tommy John that makes it more successful and they don't require or need a second or third?
Well, you asked a couple of pretty loaded questions here. Number one, I always have people who come in. I've done a lot of Tommy Johns. I've done over 3,000 of them, and again, that's over a 30-year career. But number one, why did their ligament fail? And when you fix it, obviously You're not going to make a ligament that's better than God made it, but what are you going to do to help him do? It's no different than ACL or some of the other procedures that we do. What are we going to do to minimize the chances of it happening again? We do know that Tommy John surgery, if you talk at the big league level, has got about an average time frame of about 6 years. Now the problem with that is that's great. If you're in the big leagues and you played for 4 or 5 years and you're going to get 6, 7 years, 8 years out of a Tommy John, that's going to be the span of your career. Our problem is a lot of these youngsters are getting Tommy Johns at a very early age. And so if theirs only lasts 6 or 7 years, we want to give them the chance to be able to make it to the minor leagues and fulfill their dreams. So the goal for us is to understand and educate and teach our younger coaches for these young kids how to do maintenance work, how to prevent decreased workload. We know that fatigue is the #1 reason that really injuries happen, and certainly in the case of Tommy John, it's fatigue, arm fatigue, and these kids are playing way too much, throwing way too hard, throwing breaking balls and things they shouldn't be doing way too early, and we have to minimize that. So because we know that the effects of those types of overuse, in some cases I call them abuse, that happen when they're 12, 13, 14 years old, really don't catch up to them until they're 17, 18. And that's when they're going off to college, finishing high school, and they've got their eyes set on a professional career. We want to give them every chance to get to that. So the younger kids that are having them are having their second procedure done. Now that we do a second procedure, and we know that doesn't work as well as the first, I think a lot of the kids that have had their Tommy John done the first time, the reason that they do better is they understand how important it is to maintain shoulder strength, shoulder motion, core strength. They understand the process of what they need to do that made them better between their surgical procedure and the time they got back on the mound. And again, that's not me necessarily, but it's all the people around me, whether it be our therapists, trainers, chiropractors, movement specialists, strength and conditioning, that educate these kids and the trainers and the schools and the programs they work with, so they can diminish that chance of re-injury. So it doesn't always work. We've got some superstars out there that have had their third Tommy John, but again, I think the process of learning these things increases the longevity of their playing days, which is important to me.
What's your advice for up and coming sports medicine orthopedic surgeons?
#1, always be ethical. Always follow the literature. Always be straight and honest with your athletes, and understand that it's a privilege to take care of these really high-level players. And again, at all levels. I don't care if it's recreation or select soccer. It doesn't matter the sport, and make it fun. For a doctor who loves sports and goes into sports medicine for the right reason, understand that it's important to be part of the team, part of the organization, and have them accept you as part of it. Again, being there at the good times, the bad times, the healthy times, the unhealthy times, and developing the respect that you have for the sport and the athlete so they can ultimately respect you for being there to try to help them. Too many times guys sit in their office and expect injuries to come to them, and they do, but if you're going to make a career and make it enjoyable and not just a job, immerse yourself in the games that you love, the sport that you love, be part of it, and it makes it so much fun. There's no better thing for me to finish up in the office and go down to the ballpark, see batting practice, hang out with the guys, and look forward to the game, pulling and hope that they win, or go home and watch it on TV when they're away to watch the team play and hope for a win, or watch the fellow that you might have taken care of pitch or play the field, and it's just fun. It just becomes part of you, and that can happen at the high school level with football in the fall or basketball. It doesn't make it a job. It makes it a career, and if you can do that, it's a home run, because everybody who comes into your office, every athlete you see in the training room, can recognize somebody who's doing it for the love of the game or doing it for other reasons.
Perfect. That's all I got. Thanks for your time.
That's all I got.
Thanks for your time. It's a pleasure, and we hope to have a great year this year with the Reds and continue pushing things forward.
Very optimistic. It's my 30th year, and I'm very optimistic. I mean, the front office has done great. We have a great clubhouse, about a great number of kids that I call them kids now that are down there. I think they pull it all together with an unbelievable manager. We've got ownership down with the Reds that is really willing to do anything to help this team and let them win. We came up a little short last year, but I really think that this is the year that we're gonna do some pretty fun things. So come down and watch. I'm excited for March 26th against the Red Sox down at Great American Ballpark.
What's been your over 30 years? There's got to be a story or two that sticks out. A good story that sticks out that you can tell.
I've got a lot of stories that stick out. I mean, I can talk about the stories about the players have to do with their personalities. I mean, I have seen some of the greatest athletes and greatest guys come through. I don't care if it's Barry Larkin, Ken Griffey Jr., Deion Sanders, Hal Morris, Brett Boone. We'll go down to Reggie Sanders, who basically looks like he could still play. But the stories about they all have their unique personalities and how they all fit. More recently, guys like Joey Votto, who's probably the most really introspectively studied the game and he knew more about baseball and knew more about hitting. One of the great stories I do love, though, is, and before he passed, one of the great things I've been able to do is my childhood idols were a number of the early 70s Reds baseball team. And I've had an opportunity to treat as a physician all of them. And they are tremendous guys. I mean, they're icons in our region. They're icons around the country. But, a number of years ago, 3 or 4 or 5 years ago, they let Pete Rose come down to the clubhouse area in the batting cage inside. And he put on a clinic. And you would think that a lot of the young guys, they didn't want to hear an old guy how he played baseball. But all the guys gathered around a batting cage and their eyes were glued to Pete Rose. And he stood in that batting cage and talked about when he took batting practice, how they had to hit 20 straight balls straight up the middle, line drives, or they couldn't get out of the cage. Now guys get up there and they swing for the fences, try to hit home runs to left or right. But it was a real clinic on how to use the bat, how to maneuver the bat, approaches to hitting. And guys were sitting there mesmerized by obviously the all-time hit king. But there's certainly 2 generations difference between the two. But just watched how they were mesmerized listening to every word he had to say. And it was fascinating to me to listen to him about hitting, things that I never thought about. And I played baseball all the way through college, and I was mesmerized. It was one of the greatest experiences I've had that I can remember in baseball.
I do have another quick question. What was it like working or being mentored by Dr. James Andrews?
Jim Andrews taught me. I did my training in Boston, and Boston was an old, staunch, classic training. The hollowed halls of the Mass General and New England Baptist Hospital, white coats. It was different. It was very stale, but very traditional. I went down to Birmingham. It was like the 3-ring circus. I mean, he had pictures on the walls. He had an approach to patients that taught me on how to sit down and talk to patients and get engaged with them. He had an ability to break down somebody's injury and what their sport meant to them. It was incredible. And I took a lot of the things that I learned there and I brought them here in 1993 to Cincinnati. And they were foreign to Cincinnati. Everybody thought I was nuts. But that whole attitude of no white coat, no sports coat, no stale alcohol smell in the halls. This is, you walk in and it's sports memorabilia, it's story behind every picture. It's a guy coming in a polo shirt or an open shirt, basically like, hey, I'm here for you. And I've got all the facilities and all the people around me to help you get back on a field and do the things you want to do. It was an incredible lesson in the art of medicine. And I think sports medicine in many regards is the art of medicine. You've got to know medicine, but there's an art to understanding how to connect with people, especially young people, motivate them, and get them back on the field. He was absolutely incredible. I'll never forget operating. We had viewing rooms like we do here, kind of gave me the idea for viewing rooms in the operating room, the transparency. But I remember standing operating, having Bo Jackson watching me scope a knee, or watching Bart Starr, played for the Green Bay Packers, who lived in Birmingham, watch me scope a shoulder. It was absolutely incredible, the people that came through there, how he treated them, how they respected and revered him, and just how he went about taking care of teams and business. It was the greatest educational situation I'd ever been in. And I give him a lot of credit for helping me in my career, what I was able to do, and really give me that vision and that head start of how do I stay ahead of the game. And it's always hard to stay ahead of the game, but I want to give him kudos. He's one of my great mentors that I'll never forget and have the ultimate respect for him.
Just a quick moment for reflection. He was a mentor for you. You have many fellows that work underneath you. What do you hope they take from you?
I like the same thing. We're all different. We all have different approaches. I hope they take, and we have a bunch of guys here that are quality orthopedic surgeons at Beacon, but I hope they take what we do well and put it in their armamentarium, obviously be able to do it in their own way, their own language, their own comfort level. Take the things they don't, some of the things they might not like as well, and kind of put those to the side and be able to build on that. That's what I've done. And so they say, well, we like the way he handles teams or players, or does an ACL or Tommy John this way, or whatever it might be. How he approaches going down to the ballpark and approaches the players. Obviously, there's an age difference. So I hope they take those good things and take them into their community because, number one, I want them to be successful. But as good as they are doing that, that's only going to be great for their community. When we built our place here, everybody thought we were crazy in the early 2000s. They thought we were spending too much money. And I always believed you want to give back to your community. And we built them. It was the old, if you build it, they will come. Because if you build the right facility with the right people, with the right mindset, people will seek you out because they want that. They want expedient care. They want good quality care. And they want to be able to get better, whether they go back to recreational sports, whether they want to go back to work, whether they just want to feel better because they've got arthritis of their knee. So you got to kind of think out of the box. At the end of the day, you went into medicine to help people. All the other stuff that's happening with insurances and the business aspect of it is beyond me. But we're here to help people and serve our community. And I still feel very strongly about that, and I hope they take that message with them.
It's great.